Hi, I'm here with Christina, and she just finished her treatment, and I wanted to just ask her a few questions on why she came in, what treatment she's had, and then how she responded after she was done with the treatment with us. So, what first brought you in?
The amount of pain I was in, and the treatment I was in, currently doing at the time prior to coming in, wasn't helping me.
And where was your pain, Christina?
My pain was in my back, my lower back, and my hip, all the way down my leg.
So it was going all the way down your leg?
My leg to my foot.
And to your foot. And were you feeling pain or numbness or tingling or both?
Both.
Okay. And then you mentioned you had treatment prior to coming to see me. What treatment did you have?
I was having injections, mainly injections and physical therapy.
Yeah.
Both land and water therapy.
Yeah. And those are good forms of treatment, right?
Right.
But a lot of times those types of treatments will help reduce the pain, but if the pain is coming from a disc, it really won't do much for the disc pain,
right,
or the pain that's radiating down the leg, right?
Right.
And did you have some relief with the injections and the physical therapy?
I did have some relief, but it wasn't long term. It would only last for like 1 or 2 months, and then it would, even during those 1 or 2 months, I would have episodes of inflamed pain, and then but not as bad as if I had no injection.
Yeah.
But then after about 2 months, it would be back to a 10 of severe pain.
And how long were you suffering like that?
For about 2 or 3 years.
Wow.
After, I remember it was during my pregnancy with my daughter, my first daughter.
That's when it first started.
Yeah, the last trimester.
And then did it progress?
Yeah.
Over the years?
Over the years, it was progressing to the point where I couldn't house clean, I couldn't cook, sitting, standing, any motion, sleeping in, my bed, and it was just awful, very painful.
So, would you say it wasn't necessarily the pain that brought you in, but how the pain was starting to affect the quality of your life?
Yes, because I was starting to feel like I felt like I was gonna be wheelchair bound because of the amount of pain I was in, and I was getting no relief, and I wasn't sure if surgery was right for me, and I wasn't sure if that was what I wanted, because I felt like there was something else out there that could help me.
Right.
I didn't want to give up yet.
Yeah. And then, when did you start the decompression treatment with us?
I believe it was in October, around October, and it's been amazing to see the transformation of the pain just start to go. I like to reference numbers, from a number 10 down to now today I'm able to walk and have pretty much no pain. Like I'm almost at a 0 from the last time we even touched base.
And when we first started, you were at a.
I was at 10, easy.
And now you say you're at 0.
I'm at a 0. Occasionally, I might hit a 1 or 2 in the last week or so, but I've been able to do a lot of things that I've never been able to do. I've been able to do trick-or-treating that I missed out on the last 2 years. I've been able to walk the Christmas lights and make Christmas cookies with my daughters and clean the house, and I feel like I almost got my life back, and I could almost cry because it just means that much to me that I can do these things.
Yeah,
I'm sorry.
That's okay. That's okay, and that's amazing, right? And again, when I have a patient come in for care, I know it's not their pain that's bringing them in, but how the pain is starting to affect those things that they enjoy doing with their family, or just activities in general, or hobbies, right? So the fact that you had relief, not only relief, but the fact that you were able to get out there with your kids and enjoy the holidays this year, or last year, is an amazing story. It's a story of encouragement. It helps other people that aren't familiar with what decompression and laser does. Right. So, and that's the whole purpose of why we're doing this, right? So that your story can help other people just kind of take a look into what we do, because we can help a lot of people that aren't finding relief in other areas.
Yeah, I'm so grateful for your office and me taking the chance to invest in this type of treatment, because I don't know where I would be at right now without it. I was going down a road. I felt like even depression might have started coming on too. So I'm very happy.
Yeah, I remember you telling me that you were starting to feel some depression, right?
Yeah.
And again, that goes back to how it's not just the pain, but how the pain is affecting you emotionally and the quality of your life, right? Would you recommend someone who's having back pain from disc that's radiating down the leg?
No doubt. I would recommend it in a heartbeat. So,
awesome.
Yeah.
Awesome. Well, thank you.
You're welcome.
I really appreciate you taking the time. So thank you for listening. And again, what a great story. it's an encouragement to those out there that are looking for something that may help them where they haven't found relief with other forms of conservative care. All right.